everyone. Just waiting and we will start. Sorry, I was a little late. It's a little hectic over here. Can you just give me a thumbs up if you can hear me okay?
Hey.
Hi, how are you?
Good, how are you?
I'm good. I'm sorry I was late.
It's all good, no worries. It's good to finally meet you.
I know, you too. I'm very excited about this. I got more questions for this live than I think I've gotten for any live so far. Can you hear me okay?
Yeah.
Yeah, okay. So welcome everybody. Thanks for coming. This is going to be very, very good, very informative. I will let Adriana introduce herself, but I'm going to read her bio. It really does her no justice, to be honest, because if you don't follow her, let's get your shift together. I'll have her information on my page, but you really should, because her ability to take a very gut-wrenching topic and make it into something so, I don't want to say laughable, but like with this flare of sarcasm that is, you do it so beautifully and so well that I fell in love with it when I watched it. Yeah, so awesome. I highly recommend everybody follow her because she's great. So I'm going to embarrass you some more. So actually, before we get started, we had a ton of questions, so we'll answer those first, and then you guys can feel free to submit your questions. Submit them if you can through the question thing rather than on the screen, because I can't really see, and yeah, it'll be easier if you put it through the questions. So the questions that people submitted ahead of time, we'll get through those first. Also, please keep in mind, Adriana and I cannot address specific personal questions about your personal relationships. Remember, I always say this, Instagram is not therapy. But we will answer questions that are general, that obviously will help many of you. So, all right, let me start. Adriana Bucci.
You got it.
Adriana Bucci is a life coach based in Toronto, Canada. She empowers her clients worldwide to heal from narcissistic abuse and the emotional, mental, and physical pain that comes along with it. After her own 4-year struggle with physical chronic pain, she learned about the mind-body connection in the work of Dr. John Sarno. In a nutshell, chronic pain can be linked to repressed emotions from childhood trauma. After doing her inner work around her childhood, having been raised by a narcissistic mother, her chronic pain went away, and this inspired her to be a life coach to help others who are facing similar issues. So I will let you take it away and kind of explain to people what you do more specifically.
Yeah, so I'm a coach, not a therapist or anything like that, just to make that very clear. Because, and like I basically help people who are dealing with narcissistic abuse recovery. A lot of the times, these are people who have been through years of therapy and, not shitting on therapy at all, but a lot of the times there's they just don't know how to deal with people who have been through narcissistic abuse, and it can sometimes make the survivor feel like there's something even more wrong with them than just the fact that they're having a very appropriate reaction to the abuse that they've been through. Mm-hmm. So yeah, I mean, I did therapy for years. I had no idea that I was even traumatized until the whole chronic pain thing happened for me. And it was an absolute nightmare. Like I ended up with trigeminal neuralgia towards the end, which it's nicknamed the suicide. Yeah, it was a nightmare. Like I literally, it was like October 2018, and it was after I got shingles in my mouth. at the ripe old age of 30 with like braces on and like this stupid appliance to rearrange my jaw because that was going to make my migraines magically go away or something. And I was literally like, I don't want to see my 40th birthday because this is horrifying. And I'll give my husband 10 more years before he has to call himself a widower. But that was literally my thought process. It was bad. And then I discovered the mind-body connection, started doing the inner work, and realized like, okay, I guess I did have trauma after all. I knew I was raised by a narcissistic mother, but I didn't know that that was necessarily trauma or anything like that. So I started my coaching just as like a pain coach, like helping people with their chronic pain, helping them do that inner work to like heal from the pain, because it really is linked to repressed emotions from that trauma. And then the more I started to sort of like share my story and talk about my mom and all that kind of stuff, I realized like, wow, this is something that needs to be talked about more, because obviously there's not that many resources on it. And yeah, that's kind of in a nutshell what brought me here. And yeah, I help people all over the world, and I'm just starting to do boot camps now so I can like reach even more people to, help with other like specific things when it comes to narcissistic abuse recovery. So things like, setting and keeping boundaries with the narcissist in your life. There's other ones coming up in the future, so stay tuned. And yeah, I guess that was a very long-winded answer.
No, that was great. No, I think it's great. And I think it's so important because like you said, and it's been my experience as well, that, I'll have people say, do you know anybody who specifically works with, adult children of narcissistic parents, or, spouses of narcissistic partners? And it's the kind of diagnosis where if you don't know the nuances of it, it's almost more dangerous to treat a survivor or somebody going through it, because if you don't pick up on these very small manipulative gaslighting tactics that can be so tiny, you can invalidate the person's emotion. You can invalidate their entire story, their entire world, and they feel even more lost and more confused. They bring their spouse in, the spouse charms them, maybe they're overreacting. And so it gets very complicated. So it's very important to find somebody who really understands the nuances of that, to kind of have that be your safe space, to know that nobody is going to think you're overreacting. Nobody's going to think you're crazy. Exactly. It's so, so important. And like you said, I have so many people that'll come in because they're having difficulty in their relationship or difficulty getting along with a family member that's been difficult their whole life. And they don't identify it as abuse because there's no hitting, there's no sexual abuse, there's no grabbing. There sometimes isn't even any. And guys, tell me if this makes sense, because I want to make sure I explain this well. Sometimes there isn't even any identifiable verbal abuse. Right? Like, no, there may not even be somebody saying you're a piece of shit, right? Exactly. Like, you're nothing, you're worthless. A lot of times that's not there, which makes it difficult to identify that there's abuse going on. And we'll talk about kind of those other types of abuse that fly under the radar, that even if you are the person receiving it, you may not even realize. And then 20, 30 years later, you end up with migraines and IBS and, all of these type of autoimmune, it really wreaks havoc on your body. And, the one thing and I'm sure you agree with me on this, if you take anything from this today, please understand that your mind and your body are not separate things. They are the same entire thing. Your head is on your body. It is not separate. Exactly. And, it's got to go somewhere, and it gets stored in muscle memory. Your body holds on to it. It's not like this kind of cliche, repressed emotions and, can make you sick. It literally physically it actually truly can. Physiologically, there is a difference. It causes cancer. It causes all heart disease. And so you have to be really careful with that and treat it as if it's like diabetes or anything like that. Okay. So I'm going to shut up and I'm going to start reading some of these questions, and I guess we can kind of tag team answering these questions. And again, for the people that signed on, we're going to go through the questions we received first, and then if we have time, we'll answer the other ones that you guys submit. And again, please understand we can't answer specific personal questions about your own situation in life as much as we would like to. That's not what this is for. So first question, which I always love when people ask, because it's one of my favorite things to answer. Do narcissists actually know that they're narcissists? Do they know what they're doing? My answer is yes. They know exactly what they're doing. They know what they're doing.
Yeah. They're doing whatever it takes to get supply. So like their comfort with
supply is for people.
Yeah. Yeah, for sure. So narcissistic supply is basically what the narcissist feeds off of when they're interacting with you. So that could be your emotional reaction. If it's a relationship, it could be like, you know, sex, attention, stuff like that. But usually it's your emotional reaction. And the more that you engage with them, the more you are giving them supply, and they literally feed off of that. And it gives them like this sense of superiority, power, happiness, joy. Like they get a little kick out of seeing you in distress.
Right.
And literally that is more important to them than considering what it is they're doing to you to get that reaction out of you. So yeah, they know what they're doing.
They know exactly what they're doing.
Yeah.
You know, people say, well, how do I know, you know, that he's not just an asshole, or she's not just this, or it's not specific just to a relationship. Somebody who has we'll talk about the difference between narcissistic features and narcissistic personality disorder, because I'm kind of we'll talk about that. But narcissistic personality disorder is not just isolated to your relationship. They will be like that throughout all domains of their life. They may appear to be charming outside of your world with them, but understand that charmingness is part of the manipulation, right? Or if you start dating somebody the way they are in the beginning, when they're giving you gifts and telling you they're your soulmate and they love you, and it's that's not them, right? Exactly. It's who they are after that stage is over, and people keep trying to get back to that original stage, but that was never them to begin with.
Exactly.
So it's important to remember that, yes, they know what they're doing. Everything they do is to get themselves fuel or get themselves supply. And when you can no longer provide that to them, not because you're choosing not to, but just because they're not getting what they need anymore because their needs changed, they'll kind of almost like put an X on you because they don't need you right now and shelve you until they need you again.
Exactly.
And so it's not that when they come back into your life, they're changed or they miss you. They don't miss you. They miss the fuel that you give them, right? Exactly. They miss the supply because they need it. That's it. And that's all.
Exactly.
Truly, right?
Exactly.
I just want to talk about really quickly narcissistic personality disorder versus narcissistic features. Can medication help them? No. No. No, and neither can therapy. And I make a blanket statement on that, and I'll explain why later because that's one of the questions, but just, I'm sure people disagree with me, but I've done this long enough, and the research shows this. Yeah, no, they just are.
They take it to their deathbed.
Yeah, and they're not born that way. It's a learned pattern. So it's, you know, there's some research that says it's genetic, but it's really a learned pattern of behavior that they pick up. Yeah. So narcissistic personality disorder is a pervasive style of interacting with the world and others in relation to yourself. It is pervasive in the sense that it comes across all domains. Even if it looks like they are really sweet outside or really helpful to other people, that doesn't mean that they're just mean or nasty to you. What they're doing out here is not another side of them. It's part of an act. Narcissistic features. So if you look at narcissism on a continuum, right? And let's say down here you have more of a dependency style, and here you have narcissistic personality disorder. People can fluctuate on this continuum, right? They can, at times, narcissistic, I don't even like saying features, but just narcissistic style maybe can come out. But there's a difference between a narcissistic feature and style and narcissistic personality disorder. Narcissistic feature doesn't necessarily mean that they're disregarding your needs. It doesn't mean they don't have empathy towards you. It just means that in that moment, they're getting their needs met because they have to survive in that situation. And it fluctuates, which they're not like that all the time, which is why it's not a personality disorder. So if I need to present at a conference, right? Some of my narcissistic stuff, right, may peek its head out because I need that to be able to present as an expert on a topic. But that has nothing to do with my lack of empathy for somebody, right?
Right.
Right. If
And
somebody,
your intention's not to get supply from whoever you're
exactly,
presenting to. Yeah,
correct. If anything, my intention is to give others information, right?
exactly.
And there's a difference between being an asshole and being a narcissist. A narcissist, they'll say, well, how do I know? And my response is, oh, you know, right?
Yeah.
Like, you'll know. So be careful to use that term. A lot of times I think people throw it around, and when you throw it around, you have to understand really what you're saying. Narcissism is it's not being confident, right? It's not even being bossy. It's a lack of remorse, a lack of empathy.
Mm-hmm.
People are extensions of you. They are objects. They are pawns in your game.
Right.
And that's it. You only exist as they need you.
Exactly.
So do narcissists know they're narcissists? I want to hear your answer on this. My answer is yes, and they don't care, or they think that a label is beneath them and they're not even a narcissist. They're far superior to that because a narcissist keeps them in this labeled box that they're better than.
Right. Yeah, I would agree with you. And then I would also say that, like, if they do agree that they're a narcissist, they're gonna go the route of like, well, it's a mental health condition, so like that absolves me of any guilt or whatever. So
Mm-hmm.
even if they do admit to it, they're gonna use it to their advantage to like escape accountability. So yeah.
Yeah. There was actually a study done. I don't know who the researcher was, but they taught empathy to a group of, I forget what they were in jail for or prison for. I forget, they were all in for a similar reason. They taught empathy. And what ended up happening was they learned empathy, but they used it to their advantage to manipulate further
Exactly.
by using those strategies. So it's kind of like, it's just not there.
Yeah.
And there's nothing that can be done except set boundaries with them for yourself. And we'll get into that. So I thought this was a really interesting question. How do you deal with the death of a parent during no contact? So do you want to explain what no contact is and how that works? And then we'll get into that question.
Yeah, sure. So no contact is when you've like cut all communication with the narcissist and you don't associate with them under any circumstances whatsoever. I mean, when they die, things can change, obviously. You might open up the contact just to maybe get that last thing of closure that you know is not going to happen. And there's no right or wrong way to do it, right? Like my narcissistic mother died over the summer. So, you know, I definitely recently went through this. I was extraordinarily low contact with her. And just sort of keeping an eye on, because she was starting to show some signs of losing it a little bit, like dementia and all that. So I just kind of figured, you know what, if she starts saying stuff that's like really weird, maybe I'll try and get her license removed from her so she's not driving and harming people or whatever.
Right.
That was like the only real intention, and like some legal crap that I had to deal with, that my name was on everything after she died. So it was just like a shit show. But yeah, like no contact is basically when you don't talk to them. And then inevitably your narcissistic parent will probably die before you do. So it's something that you'll have to deal with at some point or another.
Right.
And yeah.
And so one of the things that I think a lot of, at least my patients have, is when they are trying to get in that position of no contact, you know, changing emails, changing phone numbers, changing locks on door, you know, all of the not answering the phone, you know, and setting up these really kind of strict, permanent boundaries. They feel a tremendous amount of guilt. And I always get the question, what if they die?
Right.
And, you know, and I say to them, well, there's a chance that they will die right before you. And that being said, there is nothing wrong with having feelings of guilt. That doesn't mean they're accurate. And it doesn't mean you're guilty. It just means you have an uncomfortable sensation that you are labeling as guilt. To assume that you're not going to have guilt cutting off a parent when then they die means that you are a good person. Good people feel emotions that are appropriate. And so it makes total sense that you would feel some sort of way cutting out a parent and then having them die. But you have to remember too, no child, and I don't work with kids, but as an adult, I could say that no child asks for this relationship.
Exactly.
But yet they are given the responsibility of how they want to handle it. And the guilt that you feel when a parent passes away, don't fight it. Don't judge it. Have it. It will go away faster the more you let yourself sit with it than trying to justify and rationalize why you should or shouldn't have it. Have it. You're human,
Exactly.
right?
Exactly.
You're
And
human.
the more you justify it, rationalize it, the more you repress it, and then
Yes.
you get pain.
And then you get pain. Yes.
Right? Then,
Yes.
you know,
That's
I
right.
was definitely like, I will say straight up, I felt every emotion that you could possibly feel while my mother was dying and eventually died. And I totally repressed because it was just like, you know, when you're in it, it's really difficult to like sit with it, right? So I would sit with it sometimes, repress it other times. And the result of me repressing, I had sciatica.
Yes. Yes.
Like it was so random.
Yes.
And then I
Yes.
just started like letting myself feel, and it, of course, it went away very quickly. But yeah, like literally like let yourself feel that guilt because it just means you are a human who experiences emotions. And I would even say that if you do cut your parents off or like your narcissistic mother, whoever, and you don't have any emotion towards it whatsoever, that would be weird.
Correct. That's
You know,
exactly
that
right.
would be kind of weird.
That's exactly right. That's exactly right. And you know, and don't confuse feeling a sense of neutrality and peace with
Yeah,
no emotion, right?
exactly.
Right? Like that's what you want almost. You want that feeling of neutrality where you kind of just are at peace with this. And
Right.
and part of it too is also grieving the loss of a relationship that you won't ever have.
Exactly.
That's another part of it too, right? So, you know, you'll see your friends, but, you know, and, you know, a lot of my patients will say this, well, my friend has this relationship with her kid and I don't have that with this, you know, and it's a grieving process you have to go through. And sometimes you grieve it while they're still alive and it can be extremely confusing.
Yeah.
And again, there's nothing wrong with that either. You're human. Of course you want a healthy relationship with a parent.
Exactly.
No kid
Exactly.
says, I would like an unhealthy relationship with my parent, right? No one says that.
Exactly. And no one cuts off their parent because their parent has been good to them, you know?
Exactly. You know, and I want people, you know, a lot of times you hear, and I am sure you heard this, but it's your mom, but it's your dad, right? But it's your brother, you know, but it's the father of your children. It's the mother of your children.
Barf.
Right. And I tell them, you know, you say, yes, correct, it is. And that's even more reason to cut them off because your parent, as a parent, should not be acting in a way that makes you feel that you need to cut them out. That's got to be bad to cut your parents out.
You would think.
Right. They have to do something bad. And so when people say that to you, I oftentimes also tell people, say, I don't expect you to understand, and that's okay. You're very fortunate that you don't understand.
Mm-hmm. Exactly.
Because what are they going to say? No, I'm not fortunate. Explain it to me. There's nothing to say after that.
Exactly.
Right? There's nothing to say. So, okay. Next question. Can boundaries truly be set and enforced within this relationship dynamic? So boundaries can be set and boundaries can be enforced. You have no control over whether the other person cares or follows your boundaries, because I'm going to tell you right now, they're not going to, in this particular dynamic, they're not going to care. Exactly. All you're doing is preventing them from getting what they need. And they will try in other ways to get what they need. So even though when you set one boundary, you're going to have to set another pretty quickly. People, when they set boundaries, will say, it's not working. The person still did X, Y, and Z. They're always going to do that. The boundary that you set is for you and you only, so you can walk away feeling a sense of empowerment and feeling like you can breathe.
Right.
And feeling a sense of control. Would you mind giving some examples maybe of how to apply that scenario, or, you know, use examples that you've done or people you've worked with have used?
Yeah, I mean, yeah, like however it is that you feel about setting the boundary is valid. Like if you feel guilty setting the boundary, feel guilty, because, you know, when you feel guilty about it, you have two options on what to do with that guilt. So number one, you can act on the guilt, and acting on it would be repressing it. Acting on it would be breaking the boundary altogether. Acting on it would be setting the boundary and then being like, okay, so now that you're more pissed off about it, I'm just gonna like not have boundaries at all and I'll just continue to suffer. That's acting on it. And
I
acting on
just want
it,
to intervene. Acting on it, I love how you say that. The purpose of acting on the guilt is avoidance. It's so that you don't have to feel it, right? So if you're sitting with the guilt and you don't like how it feels, okay, forget it, I'm just going to break the boundary. And right, so it's about not acting on the guilt and sitting with it and tolerating the discomfort of it, because it will go away sooner if you continue to maintain those boundaries. So I love that you explained it like that.
Thank you. Yeah, and that's exactly what the second option is to just feel it, right? And it's, if you really think about it, it's 5 minutes of discomfort, right? If you're fully feeling it, right? Like I know a lot of people are gonna say like, no, it's more than 5 minutes. Like I've been feeling guilty for like the past year because I tried to set a boundary. And there's a difference between like partially feeling an emotion and like just fully sitting with it, letting yourself cry it out, screaming into a pillow, whatever you have to do to release that emotion. And when you actually accept it without judging it, without acting on it, and just sitting with it, it will go away so much faster than you assume it's going to go away, because maybe you just haven't done that yet and you have to try it out before even doing it. So yeah, like it's super important to let yourself feel the guilt or whatever it is that you're feeling, and really accept the fact that, yeah, the other person is probably going to say all this random crap, XYZ, about your boundaries, and you cannot control that. So notice how that makes you feel, that you can't control how the other person behaves. Let yourself feel that and let them reign in their corner. Like let them do whatever they need to do and whatever they need to say, and just understand that it's completely bullshit whatever they're saying to you, because they're just trying to provoke you to get more supply from you, because they're pissed that you have taken away their source of supply.
That's right. That's right. And so even if it feels like they're still doing what they're doing, understand that every time you set a boundary, you basically cut that bridge between them getting supply from you versus not. And so it may look like you haven't done anything, but you have. You have cut them off at one of their angles. And that is a really empowering feeling. Do not be surprised if they tell you you're acting different, you're being rude, you're being selfish, I don't like the person you're becoming, because all of those things are being said to kind of push you back into the role that you have played for so long. In a normal dynamic without a narcissist, this still happens. I work with people all the time on setting boundaries in even like unhealthy relationships, but not narcissistic ones. And everyone's in a dance. And so one person shifts, it throws off the equilibrium, they try to push you back. The difference is those people, once they realize what's happening, are willing and able to make those changes because they have insight into it. Someone with narcissistic personality disorder, they don't care.
Exactly.
They don't care about any of that. They just want what they want it. So there is no trying to convince them, get them to see what they're doing. It's never going to happen. They will never change, and they will be like this with every single person in their life. You know, even if they, let's say it's a significant other, they break up with you and you see them out with this other person and they're buying gifts and they're taking them on vacations. I would bet I won't say life because you never, but I will bet my house on it that it's just a matter of time before it happens again. So it's they don't change. They just shift gears.
Exactly.
Okay, so next question. Okay, this was a great question. If you can explain what gaslighting is too. When they gaslight you, do you remain calm or remove yourself from the situation?
You could do both.
Mm-hmm.
Depends. Just it really depends on like your comfort level and how your boundaries are with that person. And gaslighting is when they basically make you deny your reality. So it could be anything from they literally just said something and then they're telling you, no, I never said that. And you're like, no, you totally did. And then they keep fighting you. And then you start questioning your own sanity and you think you're going crazy and you have memory issues and all that kind of stuff. And, you know, when you've been through that for like your entire lifetime, it really messes with you.
Yep.
So yeah, it's pretty much any situation where they're escaping accountability and telling you that you're not perceiving reality the way you're actually perceiving it. And they're recreating the reality to suit them and make themselves look like the good guy or whatever. And yeah, like it's good to stay calm at all times when you are dealing with a narcissist in general. So when they are gaslighting you, I would definitely encourage you to just stay as calm as possible. And that's why doing the emotional work before and during and after all of this is so helpful, because that can help you like really release some of those emotions so you have a lot more clarity around the situation, and then you can actually be more neutral when you are being smacked in the face with gaslighting.
Yeah.
Right.
And
And
it also
then
shows you that you're capable of handling it.
exactly.
Right? You give yourself the opportunity to show yourself you can do it. If you don't, you kind of deprive yourself of that opportunity to show you can do it. It's interesting you say about the memory, that you think you have memory problems, because I cannot, and I'm thinking about it, I cannot tell you how many times I have had women, I'd say like in their 40s, 50s, like unless you have some sort of rare dementia, which is not really happening, right? Unless you have some sort of frontotemporal dementia that's like insidious and it's quick and it's fast, or like Huntington's disease or something. No 40 to 50-year-old is having memory issues related to dementia unless it's anxiety related, right? So I cannot tell you how many women whose husbands referred them to therapy saying that they're concerned that they're having memory issues. And when we get into working, when I start to work with the female, it's usually a female, I realize what's going on. No, she doesn't have memory problems. You've been denying her reality for years. So of course she thinks she's forgetting things. And then she gets so anxious that you have anxiety interference. And as we all know, when we're stressed, like this last year, my memory's gone to shit. I can't remember anything. I can't formulate sentences. I don't have dementia. I don't think I have dementia, but you know, at 44, you know, I don't have dementia. I have probably anxiety and worry that's making me forget things.
Exactly.
But what I will tell you then is when the spouse does come in for a session and I have to explain, no, that's not what's going on. And I can tell, and I think you can understand this. I can tell if somebody leaves me a voicemail to set up an appointment, I can tell within the first 5 seconds of how they speak if I'm dealing with that, if narcissistic personality disorder or not. It's that palpable. It's that easy. Maybe because I've been doing it for so long, you can just,
you can smell it.
You can smell it. It's just, you hear it. And a lot of times when the spouses come in, they think they're going to win me over, charm me. And they don't. And I can tell you that and this is also why therapy doesn't work. They either walk out of my office. They don't like me because they know that I know. And they know that I'm going to help their significant other. So they don't, I'm the enemy, right? So they split us. I don't like your therapist, just like they do with your friends. I don't really like your friends. And before you know it, you're living in a cage with no social support, right? And they don't come back because they don't think anything's wrong with them, and they're definitely going to not let me call them out on their stuff. So the denying of the reality ends up being a really scary thing, because I think, and even though this wasn't a significant other for you as your mom, it makes it really difficult to leave or to break apart from the relationship, because you have become so conditioned to think that your reality is wrong and theirs is right.
Oh, for sure.
And I will have patients say to me, I don't even know what kind of music I like. I don't even know what my favorite color is. What's my favorite flavor ice cream? They have deprived them of their reality so much that they don't even trust their food preferences. Right? They literally suck that out of you. Absolutely. So when people say, well, I don't understand, why can't they just leave?
Not that simple.
It's not that simple. It's the equivalent of, forget possible abuse and financial abuse and all that, but imagine it's almost like being an adult but having the mindset of a small child that hasn't gotten out into the world yet. That is so scary, and that's kind of where they're at as far as their awareness of themselves in relation to the world. I'm not comparing them to a child, but just that lack of knowing who they are.
Right.
I think that's what I'm saying.
They
don't, like a kid doesn't know who they are yet. They haven't lived. It's kind of like all those years of living have been taken away in a sense. Right. And they have to start over, and it's so scary. So, okay, there was another really good question I saw. How do you know if the person is a narcissist? Maybe I grew up thinking people were self-absorbed.
I mean, it depends on what your definition of self-absorbed is. But if you're like, is it like this person's family? Like that's a really vague question, but if the other person is like trying to get a reaction out of you, that's how you could probably tell that they're a narcissist. Like if there's no other way of telling, just see like how they, like, are they provoking you into reacting, and how do they act when you don't react, and how do they take that? And that's like a really good way to find out, because if you are not reacting and kind of gray rocking, if they get more pissed off with you, then yeah, they're probably a narcissist. And then you can tell.
I think that's an excellent distinction. Some people think if somebody is self-absorbed, they're narcissistic. That's not the same thing. And that's why when people throw around narcissist, there's a difference between selfish and self-absorbed versus narcissist. And I think you said that brilliantly, that it's somebody who's self-absorbed. They're so into themselves. They're not trying to get anything out of you because that's not their goal at the moment. Exactly. Someone who's a narcissist only exists to the extent that they get stuff from others. So if you want to know if someone's a narcissist and you set a boundary, if they have a tantrum, if they start manipulating, if they start doing things to try to pull emotions from you and kind of piss you off or just trigger you, that's more kind of narcissism versus the self-absorption.
Yeah. Exactly. And like, just to add on, like people who are self-absorbed, like you can tell, and like, you know, that like this person just really cares about themselves, but like, you know, I'm not going to get involved with this person or whatever. Like you can definitely kind of tell that. You can tell when someone's just an asshole or a jerk, because it's like they make it known. You know what I mean?
Right.
So I mean, if you don't want to date somebody who's vain or self-absorbed or whatever, like you can tell if that person has those traits, but they're not necessarily a bad person. And that's what makes narcissistic abuse so insidious, because they just completely act like they're a great person at first, and you would never have any idea. So people who are, you know, jerks or whatever, like if they're showing it, then that's okay, because at least you know, right? But when it's a narcissist, like you actually have no clue what they're like until the honeymoon period is over. So
I think that's yes to all of that. I think that was said so well.
Thank you.
Someone who's an asshole is just an asshole, right? Somebody who is self-absorbed is self-absorbed. It doesn't mean they lack empathy. It doesn't mean they don't have awareness. Narcissists don't have, even if they're aware, they don't care, or it's such a different feeling. It's such a different vibe. It leaves you feeling crazy. Whereas when you're dealing with someone that's an asshole, it leaves you feeling angry, right? If you're dealing with someone that's self-absorbed, it leaves you feeling annoyed. A narcissist will leave you feeling just kind of, you know, especially if you're arguing with them, and the word salad, for people that don't know, it's just, they talk in this rounds about, I mean, I've had patients, spouses call and leave these messages on my voicemail that are just these, oh my, and you don't even know
what they're saying.
And the reason why they do it isn't because they can't formulate a sentence. The reason why they do it is because they need to knock you off balance so they can get what they need, do what they need to do, you know, and so everything is a strategy, you know, and I say it with such like emphasis because I really want people to understand that there is a considerable difference between an asshole and a narcissist.
Exactly.
Right?
And like when you go to like if you're having a serious conversation with an asshole, like chances are you're probably not going to have that deep of a relationship with somebody who is just an asshole, and it won't even get to that point where you're having like these deep philosophical conversations or like a request for accountability or whatever. And you know, I still think someone who's just a jerk will at least take accountability, and they'll still be a jerk anyways, and they'll admit that they're a jerk because they know about it, they're self-aware, whatever. But a narcissist is just going to throw it back in your face, make you the problem, confuse the crap out of you so that, you know, you have no idea what's going on, and the word salad.
That's right. That's right. I remember the first time I heard that, I was just like, what? I remember like, did that really happen?
Yeah.
What? You know, and I'm trained to do that. And I remember just like, oh, it's so bizarre when it happens that you're just kind of like,
am I in the twilight zone?
Be your response to it. That your response will be exactly that. Okay, so a lot of people are asking kind of the same question, so I'm just going to kind of put this all together. The general question of how do you heal? What is the process of healing? And then I also want to throw into you, how do you then trust yourself enough to, if you choose to get married or date, how do you trust yourself enough to know that you're not going to gravitate towards somebody where you are once again putting your needs second, or once again kind of being put in that role?
Yeah, so education's huge. You know, like finding out the information, learning what the signs are and understanding that. That was like, I can personally attest that education is super amazing when it comes to not repeating the same type of relationship dynamic with another narcissist, because
that's why everyone needs to follow you. Yes.
But yeah, like I dated more narcissists than I am proud to admit that I have dated in the past. And it wasn't until I had like a relatively short relationship with a narcissist, but it confused me the most out of all of them, because I think the ones before were like longer and I was able to blame myself better or whatever. And being raised by a narcissistic mother just sort of taught me that like this is normal. So it wasn't until that final relationship where I actually started Googling the guy's behavior.
Yes.
And that was the first time I Googled behavior, because I've never done it before, because I just thought this is how people treat each other. But I was so confused because he was so like into it and like love bombing, and I was the most amazing person, and out of nowhere I'm just a friend. So I was like, okay, that made no sense. So I was like, that was like more painful than, you know, it going on for like a year and just this cycle of crap. But like in hindsight, obviously, like the more amount of time you waste is more painful. Oh my God, I totally lost my train of thought. Oh, Googling the behavior. Yes.
Yourself and
right.
How to stay healthy going forward.
Yes. So I Googled the behavior. I learned all the signs, and I learned about love bombing and like the beginning signs and all that. So what I did was I did like a social experiment, and I went on a bunch of first dates. Just to see if I could like really understand the behavior, because I didn't know what healing was. I didn't know what anything was until after my chronic pain journey. So I just really tried to test myself to see if I could like spot it right away. And I could, because I did so much research and I knew what the signs were. And then I would actually like respond to them in like different ways, just to see if I would get like the typical, you know.
Can you kind of discuss, when you say I responded to them in different ways, I know what you mean, but I want to make sure everybody else is, can you explain what you mean by that when you said you responded in a different way?
Yeah, so with a few of them, I just pretended I was like super interested and like just as interested as they had shown themselves to be. And And I knew, like, I had no interest in these guys, whatever, but like, whatever, you can disagree with the ethics of doing this, but who cares? You got to do what you got to do sometimes. And like, I would literally pretend I had the same level of interest, and then I'd get ghosted.
Right. Right.
Yeah.
Right.
And then there were other ones where I was like, hey, like maybe if I like act standoffish and see like if they try even harder to pursue me, let's see what happens. And that absolutely, because like I took away supply and then they tried to get more supply. So I was like, all right, cool. I get it now. Break from dating completely, because like I don't want to deal with this anymore. And then I met my husband. So there is hope. You do not have to repeat the pattern. And healing is a completely different ballgame than education. Education can be very healing, right? Just that validation that you know you're not crazy. You know that you did everything you possibly could have to make this relationship work, and
I think
it doesn't
too,
work.
I can say, when I start to educate my patients a lot, you know, even on Instagram when I'll post things, when people hear these little nuggets of information to know that the patterns that their significant other or their parent or whoever is doing is textbook, it takes some of the power away in their mind. Because if I don't even know this person from a hole in the wall and I can predict their behavior, that's pretty telling. That means that as unique as they think they are, they're not. And they're very textbook. And so once people learn that kind of, you know, now it's more on a dimensional, but once people learn kind of that, those criteria or you know, those kind of patterns, you can't unsee it.
Exactly.
You can't unsee it. Whether you choose to go with it, that's where the healing part comes in.
Right.
But once you see it, you can't unsee it. And that's why the education piece is so powerful. But again, it's not sufficient by itself, because you can know very well there are 9 million red flags, but I'm going for it anyway.
Yeah.
Maybe this time will be different. So, you know, or maybe I can fix them because I know how to handle a narcissist now.
Yeah, no. No.
So if you can speak a little bit to healing for you, and especially with the chronic pain piece to that too. And I have a feeling I can see like a million questions. So if you're okay with, we'll do this again at some point and
for sure.
focus a little more on the chronic pain aspect, because it's so important. But if you can talk a little bit about kind of healing in general, and once you get the education, what kind of the next steps are and how that looks.
Yeah, so education, like you can get stuck in education, and I don't think that's super common. Like I understand there's like concerns of like, you know, unfollow the narc abuse recovery accounts because you're just going to be in that loop and whatever. But I think that people need the education for a certain amount of time, and then once you don't need that education anymore, then you're good to go. If you're stuck in the education, like that's a completely different problem. And I mean, I don't really know how that would be addressed, but that's a completely different problem. But once you hit that point, I think where that's it's avoidance.
I think it's that, okay, they have the information, but to actually change your own behavior when all you know is being on that other end of that continuum is really scary. So I think people think that, okay, well, I know enough, so I'll stop it when it happens, because actually having to change your entire dance, right, is extremely scary. And so I think when people feel they're focusing on education, they feel like they're doing something. Right. It's just not enough, like you said.
Exactly. Yeah, exactly. I totally agree. That makes so much sense, that they're just avoiding the reality that, you know, this is a really bad type of person to get involved with. Yeah. And like the healing part comes when you are tired of whatever the results of that trauma is. So for me, it was chronic pain. I don't think you necessarily need to get to the point where you have a pain syndrome that is nicknamed the suicide disease before you start doing the healing work. I just had no clue until I got to that point. So for me, the healing, it was literally just learning what the hell my emotions were to begin with, because I did a great job of pushing them down forever. And there's a difference between pushing down your emotions and not having empathy, right? Yes. Like you can be a master repressor and still know not to treat people like crap. So I think that was the category I fell into for sure, because when I found out about this whole mind-body connection and that like you have to feel your feelings, I was like, I don't have emotions. Like,
Right.
what is this thing talking about? What is Sarno talking about? This makes
Right.
no sense.
Right.
And yeah, like it's really all about just understanding that emotions are a physical process, and it has to do with your childhood, why you're repressing them. So if you were raised by a narcissist like I was, like my emotions were an inconvenience to my mother. So in order to be safe, I had to push them down, and I had to make sure that I was catering to her emotions and making sure that she didn't blow a gasket because I don't know, like left a candy wrapper on the counter or
And
something.
when the day before leaving a candy wrapper, she picked it up and threw it out and said nothing.
Exactly.
Right.
Exactly. You know?
Right.
So it's just like the goalpost keeps moving all the time. So you learn from a very young age that it's not okay to have emotions and it's not safe, because then you get ridiculed for it. And it's like you're a child, like you're 6 years old. It's okay for a 6-year-old to cry when they scrape their knee, or they lose their toy or whatever it is, or their mom yells at them or whatever.
Mm-hmm.
And just understanding that, like, I went through just a human experience and there was actually nothing wrong with me. It was just a matter of releasing these emotions and figuring out how to feel these emotions. What strategies, like journaling was my lifesaver. I recommend it to anybody. And like, not Dear Diary, this happened today and it sucked.
I'm glad you said that, because journaling is actually a very behavioral based tool.
Yeah.
Because it's not just about free writing. It's getting this stuff in here and putting it out here and having it be objective, so that you and your thoughts and your feelings are not like all mushed together. It's so that you can separate it, almost like the movie credits when you're watching a movie, right?
Yeah.
They're still there. Your feelings, your thoughts about this are never going away.
Right.
You just carry them differently.
Exactly.
Right? Like, rather than carrying them in your, like, literally in your muscle and in your tissue.
Yeah.
You are carrying, right? You're carrying them outside, out here. Yeah. They're still there. There's no way that somebody, and I tell people this, and it kind of takes the heaviness, the responsibility of, there's no way that somebody who has grown up in an abusive environment will not carry parts of that with them. It's part of who they are. It's part of why they are the way they are and who they become, for better or worse. But any type of trauma, the reason why a trauma becomes a post-traumatic stress disorder is because we don't incorporate it into kind of our sense of being, in a way. And so it's kind of like it sits on the outside of your head, right?
Right.
So you have to process it. And a lot of people feel like if they process it, they're going to fall apart, when in fact the opposite is true. And so I mean, I don't want to speak for you, but I don't think just because you have done so much healing work that you are completely free of any anxieties or any, no, right? I mean,
God, no.
Right. So it's important to remember that it's not, the goal isn't to get rid of any of this. The goal is to carry it differently throughout your life, so it's not as debilitating, it's not as heavy, so that you can live your life and at the same time be anxious sometimes. Right?
Exactly.
Rather than having a migraine and not being able to get out of bed for 3 days and not socializing, and then you're even more anxious and more depressed and you don't know why.
Exactly. Exactly. Like 1000%. And like, yeah, I mean, am I way better than I was 2 years ago? God, yeah. Like, there's no question that I have done leaps and bounds since I first discovered this whole emotional thing. But at the same time, I'm not this perfectly healed unicorn who never experiences anxiety. Like, of course I have anxiety. I have imposter syndrome to the max. Like, it just is what it is. But when this stuff comes up for me now, I approach it a lot differently. Whereas before, I would be like, okay, like, it's been more than 2 weeks that I've been feeling like this. I need to go see my doctor. And I need to get on medication immediately, again, for like the 100th time. And I need to go to therapy immediately. And let's see what happens. It's, instead of that, and there's nothing wrong with doing that. Like, if you need that, you need that, do it. Like, talk to your doctor, follow medical advice at all times, like, by all means, right? But when you start doing the healing work, I thought I would have fallen apart by feeling my feelings, because, you just think that like crying is such a bad thing, and crying means you're having a mental breakdown or something horrible or whatever.
Having an opinion, right? Anything, having an opinion, having a feeling, an emotion, a thought. I mean, anything. And it could be fine 1 minute and not fine the next minute. So it's better to just, right?
Exactly.
Um,
And
but
understanding that the feelings do pass. Like when you do have it, it will go away if you allow it to be there. And
right,
the more you push it down, the worse it's going to feel, because running away and anticipating the emotion is worse than actually feeling the
correct.
emotion.
Correct. That anticipatory anxiety and that
Hmm.
effort and that energy is worse. The
Yeah.
way I like to describe emotions like this is kind of like, not to sound like I don't like the, I'm more of a behaviorist, so when I say this, I don't mean to sound like really cheesy, but um, emotions, especially trauma emotions, are there. It's like energy almost. It's like
Yes.
flowing energy, right?
Energy and motion.
Energy, right?
Emotion.
So if you think about it, think about a train, right? And so a train's coming at you, and if you want let's say the train's really loud,
Mhm.
and you can't stand the noise. You're in your house and it's rattling and you can't stand it. You need the noise to go away, right? Let's say you need your emotions to go away because you don't like how they feel. How are you going to get that noise to stop? Are you going to go outside and try to stop the train, which one will exhaust you and run you over, but two, why would you stop something when the noise is bothering you? It's the opposite, right? You need to let the train pass through and then the noise stops. If you
Exactly.
try to stop it by putting your hands up there and the force is coming at you, all it's going to do is make the noise last longer. So people
Yeah.
think that by trying to stop having an emotion, you're stopping the noise.
Right.
You're not. You're prolonging
Exactly.
it and you're
Exactly.
exhausting yourself, right?
Exactly. And it's
Whereas
not going anywhere.
it's not going anywhere. So if you just stay in your house and sit with that noise for 30 seconds, it's going to go away so much faster, and you've conserved your energy, you've conserved your sanity, you can spend that time with your family, with your friends, doing work. So we have this conception that we have to stop because you were taught that,
Yeah.
right? So it makes sense. And so the
Yeah.
opposite is actually true. And a narcissist
Exactly.
knows that.
Yes.
They know
Exactly.
that.
Exactly.
So we have a couple minutes left.
Yeah.
We have so many questions that I got. I don't want you guys to think that I'm ignoring your questions that you submitted on Instagram. We will do this again. I do lives on this constantly. I'm going to do a workshop in a couple weeks. And also on my highlights and also on your page. Both of us have a ton of stuff on narcissistic personality disorder. Hers are way funnier and way more engaging and entertaining than mine. But in my highlights, I have things that are labeled NPD. There's like 3 or 4 sections on it. So feel free to do that. This live will be saved on my IGTV as well as yours, also on my YouTube channel. So you'll always be able to access it. It's not going anywhere. It will always be up. Any kind of final words that, I know there's so many questions, I feel so bad, but any kind of, any thing that you would really want people to know who are going through this, who are either in the beginning, the middle, or where you're at, you know, in all these stages? Any words of wisdom for them?
Honestly, like the best thing I can say is that you're not crazy. Like
Yeah.
that's what I'll end off with. Like you are not crazy. There's a reason you started Googling your parents' behavior or your significant other's behavior. There's a reason for it, and it's not because there's something wrong with you. It's because there is something wrong with the way that they treat you. And, you know, in a nutshell, like whatever the narcissist tells you, whatever it is that they are trying to make you believe about yourself, is just them projecting their own crap and insecurities onto you because they want to be in control, right? And when people are in a state of feeling like shit about themselves, feeling guilty, fearful, whatever, they're easier to control.
Yes.
And that's what the narcissist goal is. They want to have you in that state so that they can keep controlling you for however long you'll
Right.
be giving them supply for. And it's not, you're not the issue. You are not
Right.
the issue.
Right. And
Yeah.
that detailed web that they spin that you're talking about, that's how you know the difference between someone who's a self-absorbed asshole and someone who's a narcissist.
Yes.
Right?
Yes.
The amount of mental effort and energy that is involved in a narcissist spinning their web and their dynamics is so multifaceted, multi-layered, so complex, so thought out. Whereas an asshole is just an asshole.
Exactly.
Right? So a lot of you guys ask those kind of questions, and so that's really kind of how you know. You just know.
Yeah.
You just know. Once you are aware and you know the signs, like I said, you can't unsee it. What you choose to do with that information is part of the healing process that you were talking about. But the education is definitely the first step. So if you're on here and you were listening, that means that you get that and you understand that. And this is not easy stuff to hear, right? It's a lot of kind of, oh crap, this is what I'm dealing with. Now what do I do? Right?
Exactly.
So
and that's normal. That's normal too. Like when I first found out my mom was a narcissist in 2014, I immediately put my head back up my ass for like a year and a half because I didn't want to accept it.
Correct.
Yeah. I was okay accepting that like my exes were narcissists, but like when it's your mother, it's like, oh my God, like my whole life was a lie. I can't deal with that. So, you know, I just shoved it to the side until more truth stuff came out. And then I was like, okay, fine. I have to do something about this. But you don't have to wait till then.
I mean, as a therapist and as someone who follows you and loves all your stuff, I can tell you, and you know, for those of you who don't follow her, like I said, please follow her. Her information's on my Instagram. But you have clearly done your work. You have clearly made such an effort to understand such a doozy of a diagnosis. And you know, you really have helped so many people, and you do it in such a way, I think, that makes people, whereas I'm like, they know what they're doing, you know, and I'm very tough about it. Whereas you kind of take it and you make it as funny as something like this could be, you make it hilarious. And I think it's a really good way for people to be able to start the healing process and understand it and not feel so stressed and anxious, because you kind of, your videos take away the narcissist power in and of themselves. You're you know, like you're making fun of them, and it's amazing because I think it makes a survivor or somebody who's going through this, it feels safe for them. Yeah. You make it a very, I think that's the word I was trying to say. You make it very safe for people. And so thank you, because there's not many places for people to go to feel that. So
thank you. I appreciate it.
Yeah. Thank you so much for joining me on this, and we will.
Thanks for having me.
We're gonna have to do this again because
for sure. Yeah.
I've been
obviously this is happening again.
Well, thank you guys so much. This will be on IGTV. I'll post it now. And thank you so much. This was amazing.
Thanks for having me.
Thank you. All right. I'll talk to you soon.
Bye.
Bye-bye.